Today I'm back with another interesting health topic about which you should know so that your life becomes easy. Bronchial asthma. What is it? What are the causes? What are the signs and symptoms? What you can do about it? When does it become a medical emergency? And how you are going to treat it and how you are going to prevent it. This is all what we are going to talk about. I am Dr. Mariam Mateek. Bronchial asthma is a chronic respiratory illness in which there is inflammation of the lower respiratory airways. The airways are supposed to take the oxygen and the other gases to and fro from the lungs and therefore help in breathing. So when there is a chronic inflammation, these swell up and there is decrease in the size of their lumen. As a result, there is a breathing difficulty and a typical whistling sound that comes from the breath. So what causes it? Does it happen to everyone? No, it does not. There are numerous reasons. The very first one is that it is familial. It runs in families. It comes in the genes. Then there are allergies. People who are more prone to respiratory allergies can tend to develop asthma. Then those of us who have the habit of smoking, those of us who are overweight, who are obese, or who are having any acute viral or bacterial infections, they can get their asthma triggered. Then there can be all that dust and dander and moles and mites in the dry, cold air, and they can be simply the unhygienic conditions in and around your place in which the house is not properly cleaned. There are moles, mites, cockroach droppings and everything which can all trigger asthma attacks. Now there is no cure for asthma, but we are very lucky that there are very effective strategies that can be adopted to prevent the symptoms of asthma or to prevent acute attacks of asthma. Now, what are the symptoms? We need to know them to realize how much can be managed by yourself and when do you have to rush to the doctor. Simply, there will be shortness of breath. You will be feeling breathless. Then there will be coughing, which will be more pronounced at night. It may be simply a dry cough, and if there is a super added bacterial infection, then you may be producing a phlegm, and phlegm can be will be expectorating when you cough. Then there will be a sense of tightness in the chest because our chest normally has a negative pressure inside. You must have all seen how a vacuum pump works, how it cleans. It sucks in all the air and the garbage and it deposits it in its machine. In the same way, the chest inside has a negative pressure. Therefore, the air that we are breathing in can be sucked in easily. But on the way out, if the lumen is decreased, if the secretions are thickened, then it is difficult to expel the air out. There is a typical wheezing sound. Now, what is a wheeze? It is a whistling-like sound. If you have a long bottle, narrow neck bottle at home, try to blow air into it and there will be a typical whistling sound that can be heard. This is the same sound that starts coming out of your chest when you are having this problem of asthma or you are under an acute attack. Then there will be use of the accessory muscles of respiration. Normally when we are breathing, we are talking, it is an involuntary process and it goes on unnoticed. But when you are having this shortness, then you will be using the accessory muscles. Now, which are the accessory muscles? First of all, it will be the ala nasi, the nostrils, they will be flaring up more while breathing. In the same way, the neck muscles here, they will be more strained when you are under an asthmatic attack or you are having asthma. Then the chest muscles, they will also be moving more than normal because you are putting in an extra effort to breathe and especially to breathe out. Then due to all this extra effort, you will be feeling tired, you will be having lack of energy, you may have difficulty in talking because you will be coughing and coughing or you may be breathless. Then at night also it will be difficult to sleep, and you will have sleeping spells which are disturbed because of this shortness of breath. Then when does it become a medical emergency? People who have this problem usually go to the doctor, get themselves diagnosed, and they will be taking their measures on from beforehand so that they do not land into such attacks. But when such an acute attack occurs, what are the signs that you have to notice, that you have to rush to the doctor? First of all, the coughing and the breathlessness will be persistent even when you are at rest and when you are lying down. Then the same thing, the respiratory rate, it will be quite high. It will be more than 30 breaths per minute. Your heart rate, it is going to be more than 120 beats per minute. And you will again be feeling drowsy, and if the process has been prolonged for a long time, there might be hypoxia, that is decreased oxygenation in the blood, and as a result there may be bluish discoloration of the tip of the nose, of the ear lobes, or the tips of the fingers. Sometimes it is the irritants and pollutants and even the simple exercise stress. When your body is already having this bronchospasm, then these can also trigger the asthmas. Now, what do you have to do for it? You know the causes. What are the causes? If it is familial, it is genetic, you cannot do much about it, you cannot change your family, but yes, you can try to avoid intermarriages in the family. Then if it is due to the dust, mite, pollen, dander in the air, then while you are moving out during this season, when there is too much dust and pollution in the air, try to wear a mask. Then keep a wet towel with you, and if you are passing through a place which has a lot of air pollution or the cars are throwing out the exhaust fumes, then you can use that wet towel also, so that all those extra fumes can get absorbed into it and you can breathe easily. Then it might be occupational, people who are working in the chemical industries, the plastic industries, the dyeing industries. They may have those fumes which are being inhaled all the time. That may cause damage to the lungs and they can have asthmatic attacks. So they have to cover themselves up properly, use proper masks, and if it is still too much for them, then they might have to change their profession. In the same way, the coal miners or people working in the mines where there is lots of dust and smoke and soot, those things can go and get deposited in your lungs, and over a long period of time they can make you go into the chronic obstructive pulmonary diseases, and there may be attacks of asthma triggered on by this damage. So those people have to take care, they have to consult the doctor, all of you have to consult the doctor, and you will be told how to manage it. Now, first and foremost, if you have the allergic tendencies, the doctor will have prescribed to you anti-allergies which are to be taken whenever you have these feelings of sneezing or shortness of breath or anything. Then you may require nasal aerosols, which will be giving you the bronchodilators or the nasal decongestants, or in severe cases steroids may be given via the nasal sprays also, and then via your inhalers also. They will give you the bronchodilators, they might give you the steroids, they can be taken in the tablet form, in the liquid form, or in the inhalers or in the nebulizer form. So your doctor will tell you all about it. What you can do on your own is try not to go out during this dusty weather. If you are going out, cover your nose and mouth, keep your inhalers with you, take your anti-allergies, quit smoking, quit alcohol consumption, then rest properly so that your immunity is all built up, take proper water, proper hydration, milk mixed with warm milk, mix a teaspoon of turmeric in it and take it at night. It will dissolve all those extra damaging fumes, and it will even soothe your system. You can add honey to it. It will be a soother as well as a disinfectant, and it will help to throw up this phlegm. So take your soups, take your dry fruits, Eat healthy, sleep well, and stay away from this problem. Manage it beforehand so that you do not land into an acute attack. Thank you and have a very nice day. Assalamu alaikum.